I'm your host, Danny Binnington, and today we're opening up an important conversation about menopause and cancer and the barriers that can make getting the right support even harder. My guest, Dr. Ferhat Udin, is a GP and menopause specialist. Today, she'll be sharing her expertise on the unique challenges faced by women from ethnic minorities, and she'll also be sharing some of her own challenges as a female doctor wearing a headscarf. But this conversation is relevant for all of us, no matter your background. We all need to break the silence around menopause, the challenge around the stigma that comes with some of our menopause symptoms, and really push for better care. Understanding different experiences helps us to support each other, advocate for change, and improve how menopause care is delivered across the board, across the world. And it's not good enough to say people just need to advocate a little bit better for themselves. That is what I have learned from this conversation today. I'm here to learn. I'm really worried I get stuff wrong. I'm here to listen and I want to get it right. And I hope you'll join me on this journey. So let's dive in. Good morning. We got over our technology problems. How are you today?
I'm really well. It's so lovely to be here today, Danny.
It's fantastic. So a few weeks ago, we met in person at a brilliant medical conference, and I got to speak to you in person, which was amazing. But for everyone that hasn't met you, can you tell us a little bit about what you do, please?
Absolutely. So I'm Dr. Ferhat Udin. I'm a GP menopause specialist. I work in the NHS, and I also am the founder of Liberty Health Clinics, which is an online menopause clinic.
That's amazing. Thank you so much. So when I spoke to you and I said, I'd love to record a podcast episode with you, I'm going to tell for everyone that is listening and not watching this, I want everyone to know that you're wearing a head covering. And I want to talk to you about the different experiences of menopause experiences and cancer experiences with different ethnic minorities. And I don't even want to assume if you're religious and that's why you're wearing a head covering, or what part of the world maybe your mothers or fathers are from. You are British. Tell me more about your origin. Tell me more about how you were raised. Tell me more about you.
Absolutely. So I was born in the UK. My parents are from Bangladesh, so we're from South Asian origin. And yeah, I'm Muslim by heritage. And I think, yeah, so I put on the headscarf aged 21, and it was always something I wanted to do. And it made sense to me at that point in my life. And to say that it's hasn't had its challenges would be wrong. There are challenges that we encounter every day, and that's women who wear it or don't wear it, challenges that women from ethnic minorities go through, and they can be very subtle challenges, little things like from the way someone will look at you, approach you, or to, big challenges from being openly discriminated against. And I think for my journey, what I've seen is, I'm very fortunate to have been educated, born in this country, having had parents who are, really encouraging and pushed me to a point where, I'm very privileged right now. I do feel that it's now my responsibility to be able to advocate for women who aren't as fortunate, who maybe don't have the skills, the education, or the language to be able to express their needs. So yes, it is definitely a passion of mine. And there are lots of health inequalities that we all know about. And some of those are very stark, some of those are very subtle. But I think as healthcare professionals or just the general public, being aware of those is really important to be able to help each other.
Thank you so much for explaining that. I think why I really wanted to talk to you and what's so relevant here is, yes, we will talk about the experience of cancer for different ethnic minorities, and then the experience of menopause and how complicated it is when you navigate both as a patient. And we'll hear more from you as a doctor. But what you've just said is this: how can we empower each person listening to this conversation to advocate for themselves? And that's what I've been trying to do for years. And you never know what it is. Does someone need their best friend to say, come on, we're going to book that doctor's appointment together? Is it for you to try and get a second opinion? Is it for someone to just say, actually, maybe I just don't need a doctor. I need a bit of lifestyle advice to help me feel better and get through the day, whatever it is. I think our conversation is hopefully going to help whoever is listening today, help them figure out how they can advocate for themselves a little bit better. As a young patient yourself, because every woman at one point is a patient themselves, when you think of your journey of becoming a woman, of menstruating, of them becoming a doctor, what challenges did you face?
Yeah, so I mean, I look back at my childhood and growing up in a Muslim family, and there are certain taboos and cultural differences that, I grew up thinking were normal, and it's only now that I look back and I'm like, well, that wasn't right. So, for example, I think within our community, we still see periods as something quite dirty, and I think culturally we're not able to pray, we're not able to go to the mosque when a woman's on a period. And I think that those connotations can actually lead to women feeling quite isolated or feeling like they can't talk about these symptoms like menstrual issues or, menopause issues, because there is still this cultural taboo and around those symptoms. So I think firstly, breaking those taboos are really important. And I know as a mum now of boys, it's something that I will openly talk about my periods now, because I grew up in a household where we couldn't. My mom would tell me that you can't tell your dad, you can't tell your brother when you're on a period because it's something dirty, and that's something I'm actively trying to change in my household and in the wider community, that these are things that we can talk about and these things that we should be talking about because they're very relevant for both men and women to know about.
Yeah. So when we move away from your personal experience to other people's experiences and patients' experiences, and you've been growing up, for example, with thinking your very natural menstrual cycle that we can't stop is something to be ashamed about, something we can't talk about, something dirty. When we are menstruating, we can't worship, which is really important to so many people. When something then goes wrong, or when something doesn't work like you think it should work, because how do you even know it works to the right way if you can't talk about it? Where do people then go as patients, and does it take them longer to go and seek the help?
Yeah, so I think this is the problem, that those barriers to seeking help, we end up, maybe seeking the wrong sources of information. I've spoken to women's groups who have spoken amongst themselves, but they are almost exacerbating those taboos because they're spreading the wrong information.
Right.
So it's actually finding the right source of information, speaking to healthcare professionals, it's speaking to people that have been through it and had the right advice given to them. So I think, just getting that information out there is so important for these women.
Can you talk a little bit more about a cancer diagnosis for ethnic minorities? So we also know that outcomes are different for different groups, different populations, even in the UK. We know that people are getting diagnosed later. The outcomes are worse for some of the Black communities, for example. What have you experienced in your work? What are some of the stats around that?
Yeah. So I think actually getting women to go to screening, that can be, I've found in the South Asian community, there is a reticence. For example, cervical screening, that's a big taboo of mine. Women are not going forward enough to get their cervical screening done, and there are lots of myths going around. For example, women just see that as, oh, it's not something we can do pre-marriage, or if you're not sexually active, there's no need to go. And yes, there is still a need to go. And women, yes, there's a lower chance of having a HPV infection when you're not sexually active, but you should still go through the screening process. So it's getting women to engage. And then there's also all those taboos around, well, I don't want a speculum done. That discomfort around it, breaking those barriers as well is so important. And then just the education, it's so easy to screen women and pick up cancers early so we can treat them early. Yeah. And the same as for mammograms, it's getting women to attend those mammograms, get that screening done. and just understanding the importance behind it.
This episode is brought to you by Pelvic Relief, a fantastic company dedicated to improving women's intimate health with science-backed solutions. They offer a carefully curated range of products, including the clinically researched and patented vaginal probiotics we talked about in last week's episode. So if you've missed that, definitely go back and check it out. I talk about it all the time. Over 80% of cancer survivors experience sexual health-related symptoms, so you're not alone. Things like vaginal dryness, irritation, painful intercourse, reoccurring UTIs, incontinence can be so incredibly challenging. But the Pelvic Relief are there to help. They've got brilliant products on their website. Check them out, from best-in-class lubricants and moisturizers to soft and supple silicone dilators. The O-Nut is on there, and plus other essential items. So if you're dealing with pelvic pain, menopause symptoms, or post-cancer recovery, do check out. It's www.pelvicrelief.co.uk. And there's also something else that's super exciting, again linked to the conversation we had on last week's podcast with Dr. Joe Bailey, a gynae oncologist. They now offer an affordable, user-friendly vaginal microbiome screening, which you can do at home, giving you insights into your unique microbiome and helping you find the right solutions for better intimate health. So if you've been struggling for a long, long time and nothing else has helped or worked, why don't you give it a go, read up on it, and ask your doctor, see if it's a solution that might benefit you too. And when you are on the outside, like I feel on the outside of those conversations, because I never truly understand how you were raised. I never truly understand your unique challenges. But when you're sort of on the outside looking in, you wouldn't even know where to tackle the problem, right? You wouldn't even think, wow, this is such a big sort of generational change and cultural change that is taking shape. How do you support all of these generations through there? When you're the one person, the doctor, in front of one of your, say, menopausal patients, do you feel there is a lot of work around that as well? Or do you think you just truly do the job as a menopause specialist? Or there's a lot of this hand-holding and educating go into your appointments now?
I think there can be, absolutely. And I think one of the biggest things that I've come across is that the challenge of, do we just push through? Our parents just pushed through. Our mums went through menopause and they never complained. And, almost that idea that suffering is almost something you just do as a woman and you just put up with it. And that there's also a huge fear around medication and especially HRT, that this is something, menopause is something God's given us, so we shouldn't be messing with it. We shouldn't be messing with hormones. We should just be going through this change naturally. And yes, I agree with that to a point, but there comes a point where actually if you're struggling and you have symptoms that are affecting your quality of life, you should be reaching out for help, because these avenues were given to us for a reason. And also just the education around things are so much safer than they used to be.
So were your parents very proud when you became a GP?
They were. Absolutely. Well, I followed in my brother's footsteps, so he was a GP first. And then, so no, they are, and they were, definitely.
And how did they react to when you wanted to become a menopause specialist, when you are trying to help people through a natural process, in their eyes, something that we're very lucky to be alive when we reach menopause naturally, right? Without, say, a surgical or like a chemical intervention. For so many of our listeners, it becomes much earlier. Did they feel the same sense of pride, or were they a bit puzzled that you would go and specialize in this area?
I think my mum was a little bit clueless, because she was like, well, what's the role of a menopause doctor? You just go through the change. You don't seek help. And that's their view, that stoic attitude. But I think subsequently she's actually seen the fact that I've reached out to our community, our local community. She's been to a lot of my talks for South Asian women, and she's seen the response, and she's seen actually that women have such a varied menopause experience, and there is a lot that can be done to support these women.
Amazing. So you are educating the older generation through your work somehow, aren't you?
Yeah.
Like it is quite amazing. I think when you go through a cancer diagnosis and you are so grateful for having received all of this cancer treatment, and then menopause is a late long-term side effect. Initially, no one talks about it. Most people say to us, they actually echo what I experienced myself, is no one said it was going to happen to that extent. You kind of feel like it's just a way, it's just what happens because you've had cancer and cancer treatment, and because you're so grateful, there isn't much you can do. So I think we're trying to educate everyone to say, yes, this might be what's happening with your cancer treatment, but actually let's argue that there's always something we can try and do at least to help you improve your symptoms. It's almost a bit like what you've done, but on a generational level and cultural level, isn't it?
Completely. And I really echo what you're saying about how women just feel grateful to be alive. And the women I meet are like, well, we've got through breast cancer, we're still here. They don't feel that they're entitled almost to complain anymore. Um, Whereas what we try and get across is, no, it's your quality of life that's important. And there is so much that can be done to improve that quality of life. And you don't need to struggle. Um, you know, we can help you with that.
Yeah. Do you have like a passion as a menopause doctor now? As your mum would say, yes, it's great you go into the community and you educate other South Asian women, for example. Do you have a passion within the menopause? Is it making people feel really amazing after a cancer diagnosis, or is it providing, fair access to HRT? Is there anything that really sort of gets you excited?
I think it's education. I think it's just
Mm,
that moment where you make women realize that, oh, this is the menopause. And then seeing that transformation that occurs when they finally do reach for help. Um,
mm.
and that's the bit I love, that realization that we don't need to suffer, we don't need to struggle anymore.
Yeah. And I hope that everyone who's come on our journey, some people have listened to these conversations for a whole year and they say, gosh, Danny, you helped me through treatment. And I listened to these episodes and I felt a little bit less alone and maybe a bit more empowered about my symptoms. It's going from a very isolating experience to suddenly, even if you don't meet another person, but suddenly realizing there are so many others, millions of others out in a similar situation. Do you think it helped you as a young doctor when you wanted to put the headscarf on? Did you look to others in your community thinking, well, she can do it, she's a doctor, she's wearing a headscarf? It gave you confidence to also navigate this with more sort of like clarity?
Yeah, no, absolutely. And I think um, I wanted to advocate for women. I wanted other women to say this can be done,
Yeah.
and and I can see that slowly happening. There are more women who are
Mm,
taking steps to further themselves and not letting cultural barriers come in the way of things. And I think the
mm,
more we do that, the easier it becomes for those people around us to make steps as well.
mm,
So yeah, no, definitely. I think some of it I did without thinking about it too much, and then
mm,
when I was in it, I was like, okay, this is a great opportunity to help other women and help women realize that the sky's the limit. They can do what
mm.
they want, and yeah, definitely just to push forward.
Mm. When we talk about menopause, we talk about a cancer diagnosis, our identity really changes and shifts of physically, it's maybe hair loss, it's maybe initially eyelashes and eyebrows. So there's an identity shift, and we accumulate scars. Our breasts might have had surgery or mastectomies, and people with gynecological cancers, there's so much internal and external scarring. After all types of cancer treatment, the identity shift is quite huge. And what often comes with it is also a loss of libido, a loss of sex drive. And that's really difficult to communicate. And the workshops we've had around intimacy, pleasure, sexual health, they've been really amazing. They've been really raw. They've been humbling. People started to share. It was amazing. Do you even have more barriers to talk about those things in your culture? Or how do you think how does it compare to other people? What do you
Yeah,
think?
no, I think that's one of the biggest barriers that I see. women, and I struggle with this with the South Asian community, they won't present with these symptoms. They won't even think a lot of the times to complain about these symptoms, because again, there is that cultural taboo around it. We don't talk about sex. We don't talk about vaginal dryness and libido. That's definitely not something we talk about much. So I think when I first started educating women in the community, I could see that look of shock on people's faces, like, oh, she's talking about sex. We don't talk about this. And I know that, that's going to take a while to shift that narrative.
Mm-hmm.
But really, that's one of the biggest barriers. I think women don't feel like they can talk about that. And then there's also, when you go and seek help from a healthcare professional, you might be sitting opposite a male doctor. And that could be something that, again, you're like, oh, well, I couldn't bring this up. This is not something I'm allowed to talk about. So really pushing that, that education, that this is something we absolutely can and should be talking about. And something interestingly I found is that is much more common in the South Asian community. And, Dana, we talk about menopause symptoms. I think one of the things that's really difficult is the fact that, women from different ethnic minorities do present differently. They have different symptoms. And for South Asian women, they may not present with your typical hot flushes and night sweats. A lot of these women actually present with vaginal dryness, vulval pain, pain on intercourse, all over body aches is a really common one. And for them, they may not recognize this as menopause. And for a healthcare professional as well, they may not. All over body pain, for example, can be put down to so many things. Psychological being the top one that I've seen. Women are just fobbed off that it's all in your head. That menopause, especially early menopause, is often completely disregarded by the woman and her doctor. So knowing and, really being aware of the differences in how women present. And I know Black women also, they present differently. They will often present maybe with more hot flashes or more severe symptoms. So a longer transition as well.
But you see, if that is the case, if the ability isn't there to talk about those symptoms, to talk about low libido, to talk about sex, we can't really expect people to self-advocate. There is no way. So then the onus has to be on the healthcare professional and the doctor and the cancer team, right? Because it is all very, like, I find it really hard to talk about low libido. In my own menopause appointments, it's everything else. And if I'm then asked the question, is there anything else? I might say, actually, I've zero libido, or we haven't had any intimacy for over 6 months, or whatever it may be. And it might come at the end. It's never the priority. I never feel like, I feel shy, I feel embarrassed, but I actually wasn't raised to not talk about it. I was raised in a very open house. We talked about sex with my friends all the time, which boys we snogged at what age. Like, it was part of our sort of like normal upbringing. And yet I find it really hard. And it's the last thing I bring up when I maybe then ask, is there something else? So we cannot ask South Asian women to then self-advocate, right? This is the wrong approach. With that in that case, the 100% onus, it needs to be on the healthcare professional, the doctor. It needs to be part of cancer services to say, we know over 88% of people will experience sexual health related symptoms after a cancer diagnosis and cancer treatment. It's our responsibility to ask, because we know
Absolutely.
a South Asian woman isn't going to ask, isn't it?
Absolutely. And for some women, when I raise it, they haven't even thought about it. They've just been like, oh, well, isn't that normal? Don't we all get that? Libido, that goes after marriage. Well, no, it doesn't. Some of these changes are to do with the menopause, and there are things that we can do about it. Painful intercourse,
Yes.
It's vaginal estrogen. You don't have to just put up with it. And, some of the stories and some of the things I've seen, women are bleeding because of their vaginal atrophy and just putting up with it. Never thought to have mentioned it. And urinary tract infections, recurrent infections over and over again, it's never really been thought of as, well, this could be menopause related. And yet when you put them on vaginal estrogens, suddenly their infections are gone, and you've saved them from all those recurrent antibiotics that they've been on and all that pain and agony that they go through. So it's really important that we ask about, have you had recurrent infections? Have you got that dryness? Have you got that pain? Definitely, I think the onus is on the healthcare professional.
I've got a very exciting announcement to make. Join us for the Boost 30 Challenge. This 30-day challenge is for anyone at any stage of their cancer journey to help boost your health your way. We're kicking off on June the 1st, but you can actually start anytime. You just have to follow 5 simple daily and weekly rules. Move your body for 45 minutes a day, drink 2 liters of water a day, read any book, fiction or non-fiction, for 15 minutes a day, cut down or cut out alcohol, and eat 30 plant points every week. And we will support you at every step of the way. And it's just a £10 donation, please, if you could, to take part. But if not, then absolutely the challenge is free for anyone. But if you do make a £10 donation and you buy a ticket, then we'll send you oodles of inspiration straight into your inbox, even including live workouts to boost your challenge even more, so that together we can feel stronger, clearer, and more energized, one day at a time. Join the Menopause and Cancer team for the Boost 30 Challenge. I put the link to sign up into the show notes. So when you walk around the corridors of your very busy NHS hospital, are you trying to give little leaflets and posters to every one of your colleagues saying, make sure that if you have a South Asian woman or a woman of a different minority, to address? I mean, we've got to start to do something more proactively, don't we? This isn't right. Yeah.
No, definitely. And also just thinking outside the box and not labeling. And we all have these internal prejudices, whether we realize it or not. It's so interesting because I've seen the health inequalities. As a house officer, as a junior doctor, I used to see it in A&E where women would come in with all over body pain or chest pain, and it would just be fobbed off as, well, this is an Asian woman. They do complain about all over body pain. And I saw it with my own eyes. Women were not being given the same investigations or the same treatment as women, maybe their white counterparts. So just being aware of those prejudices that we all have, be them subtle or not, is really eye-opening, I think.
Yeah. So, what's so difficult, again, as the observer looking in and trying to learn from you, like on the one hand side, I'm a little bit worried I get it wrong. I'm thinking, have I said something wrong? Have I used the wrong terminology? But the same goes if we talk about maybe sexual orientation, right? I'm always worried. Am I getting it wrong?
Same.
I want to stop saying women all the time. I want to say people with ovaries, because I understand not everyone defines as a woman and they need the support we've got to offer. I get it wrong 8 out of 10 times. I get it right twice out of 10 times. I'm really trying to learn. I'm trying to learn from you. If you sat opposite another doctor that is also thinking like me, I don't want to get it wrong. I don't want to upset these poor women. Maybe by asking her if she has a dry vagina, I'm making it much worse for her because I worry about insulting or saying the wrong thing. If I think it, I'm sure other doctors think it. What would you say to doctors? What can they say? What shouldn't they say? How do they start the conversation?
I think just be open and being honest. I think women from all backgrounds appreciate that. And I think the chances of offending a woman it's very small. In fact, you'll see notable relief on that woman's face that you've brought it up, that she's able to talk about it, that, it's something that's not off the table. So just really simple terminology, do you have vaginal dryness? Does it hurt when you are intimate with your husband? Those things every woman will be able to relate to and understand. And the chances of you offending a woman is very small. I wouldn't even worry about that.
That's amazing. I think, in general, for all these years, I've been really trying to learn so much. Like every person I'm meeting, like I'm meeting you today, I'm like, I'm excited to learn about your piece of the world, whether it's a cultural difference or just how maybe people have a different experience of menopause after different types of cancer. Like it was a real conscious step for me not to set up a breast cancer charity because the majority of cancer patients have breast cancer and then they're put into the menopause. It was really important to be all inclusive and support every type of cancer patient, because however they experience menopause, it's valid, their journey is valid. And there's so much. I actually think the more different people we bring into a room, the better all of our services are. Our recent wellbeing retreat, we had people after different types of cancer, and I genuinely think it was so much better because we learned so much from different experiences rather than always comparing to someone that's had a similar cancer diagnosis. And I wonder whether we can further support in general if we keep talking amongst different nationalities, different medical societies over the world, different sort of minorities and backgrounds as well. Um, as a male doctor, though, do you think that's even harder? Like, I really respect every male doctor that talks about all of those things. And of course, every doctor has training, and if they're a gynecologist, but I feel like as a male doctor, there is even more of a barrier a little bit. Or do you think South Asian women should just see female doctors, or how do they worry about a male doctor more?
I think it is hard, but I think things are changing.
Mm,
Again, I think it's harder for a woman to bring it up maybe with a male doctor, but as soon as that doctor has brought it up themselves,
yeah.
it becomes quite matter of fact at that point. At the end of the day, that's their doctor, and I think again the onus falls on the doctor to bring up the symptoms. Um, Things are changing. Women are becoming more open to having these conversations. There is more education out there. We're all a bit more aware about the menopause. There's still definitely work to be done. But I think, yeah, just opening up the conversation. And even if that woman doesn't feel comfortable in having that conversation with that particular doctor, the fact that he's planted the seeds of this is not normal if you're having vaginal dryness, if your libido has gone down, if it's painful to have intercourse, there are things we can do. It might just start that process. She may
Yeah.
just go back and go to a different doctor, but it started that chain of thought, hasn't it? And
Mm.
opened up that pathway for care.
Yeah. And because I know so little about your culture or your part of the world or your experiences, is there a question that you would like me to ask you? I genuinely think sometimes miscommunication happens because people don't ask the right questions because they know so little about the person they're talking to. What would you, if you're thinking with thousands of people from all different parts of the world listening to our conversation now, is there something you want me to ask you? What would you like to say to everyone?
I I think just nothing's off the table. I think it's just having that mentality that, don't be afraid to get things
Yeah.
wrong, Danny. Don't be
Mm.
afraid to ask questions that you would ask of anyone, because just because
Mm.
someone is from a different background, different culture,
Mm. Mm.
it may be that you might need to explain it in a different way. It may be that you might need to spend a bit longer discussing something. But I think women appreciate openness,
Mm.
and they appreciate being treated the same as every other woman out there. So definitely, like, not to tiptoe. We might get things wrong, but not to tiptoe around subjects
Mm.
is what I would say is the most important thing
Mm.
for ethnic minorities.
Yeah.
Um, yeah, and just to take symptoms seriously as well. I know when we looked at the Forceps report, um, women from ethnic minorities, from Black or Asian backgrounds, it took 30% more appointments before their menopause symptoms were taken seriously. So it's that, just being aware that, yes, sometimes women can present with a whole range of symptoms and it's difficult um, to pin things down. But yeah, just taking symptoms seriously is the other thing.
Yeah. And right at the beginning, we talked about self-advocacy and how can we help people to advocate better for themselves, regardless of where they're from, where they live, what type of cancer they've had. When you see patients in your clinic and they come in, they've kind of self-advocated already, right? Because either they've pushed for an appointment on the NHS or they've come to see you privately. How can we help other people that are sitting in the background? How can we encourage them to self-advocate? It's an easy word, self-advocacy. What does it mean?
Yeah.
Does it mean you have to be annoying and phone the doctors 25 times or?
Sometimes it can be. And sometimes one of the things I keep telling women is if you don't speak to the right doctor, try again. Try a different doctor. If someone doesn't take your symptoms seriously, if it's to the point where it's affecting your life, if it's affecting your quality of life, you're struggling, find someone. There will be someone who will eventually take your symptoms seriously. I think it's sad that it takes 30% longer, but just having that resilience and that, just keep trying would be my
Mm.
advice.
Amazing. I keep thinking now there must be loads of South Asian women in our community listening to this conversation thinking, oh my God, this is the amazing, I want to talk to her. This is a great doctor. She gets me. She's from a similar background. Can you do a workshop for them? Shall we have a look if maybe there are 20,
Absolutely.
there might be 25 people who really want to, one of the most important things for us is to sort of bridge that information gap and bring you doctors to our community. And the podcast was always meant to be me giving the microphone to people like you so that more people can listen to your wisdom and knowledge and information and like elevating your voice. It's all I ever wanted to set out. But I've come to the point where I think people need more. They need more of you. They need to be asking. I know they can't ask you proper medical questions because they're not your patients, but you could probably give them more. I wonder we should just get a date in the diary.
Oh, I would love to. I would love to. So I lived in Hong Kong for 2 years. And while I was there, I couldn't practice medicine, but I used to just do a lot of charity work. So I worked for a refugee organisation and I would do workshops. So a lot of these were women from Africa. And I loved it. I loved doing those workshops because I remember they would say, you're the first person who's ever spoken to me about this. And the conversations that would come up, all the taboos, all the misconceptions, just clearing up those misconceptions. I loved it. So yeah, I would love to carry on doing those kind of workshops. So yeah, let's make it happen.
It's amazing. I think on another level, I wonder whether we need to do some training for your counterpart doctors, for some other doctors to help them understand how to better support the South Asian community in their appointments. Because if I worry about what to say and what is the right thing, I'm sure doctors might also be great for them to support them better with some it's a communications piece as well, isn't it? It's making
Yeah.
people aware is I'm not going to let you go now. You see, the problem is I've got lots of ideas and jobs and thinking, oh my gosh, what could we do? um,
Brilliant.
that would be absolutely amazing. Thank you so much for today. I've learned loads. You've been so honest, and I love hearing a bit more about your own journey as well. And I feel sorry that you had obstacles yourself because of your culture and that you want to openly show your culture. It makes me sad that it is the way, but it is the way, isn't it, for many people like you?
And I think it's brought me to a place where I'm more aware about the challenges that other women go through and how we can help them. So I'm really grateful for all my opportunities and for getting where I am today, for sure, being able to help people.
Mm. It's amazing. Um, Thank you so much. I'm going to get off this recording now, and I'm going to get into my emails quite soon to connect you with one of the people in our
Yay!
organization for a great workshop or something.
Fantastic. I would love that.
Thank you so much. And
Thank you,
it's been a
Danny.
real pleasure to talk to you today.
Always a pleasure. Thank you.
I hope that, just like me, you have learned something about this conversation today. And I sometimes think the more we can learn about others and truly try and understand how others' experiences are true for them, the more we can learn about ourselves. Sometimes it's really difficult if all we think about is ourselves, our own world, our own challenges, our own systems in which we navigate the world. I feel we're always going to be a little bit stuck. What is eye opening and also horizons of opening is when we think and listen and learn from other experiences, because I really feel that personal growth for us is huge when we do so. And that is why I'm so passionate about collaboration and opening our services to other people. And I'm here to learn. So if this conversation has sparked an idea for you and you think, Danny, talk about this on the podcast or bring more stories on from patients about X, Y, and Z, tell me, email us. You can email us to info or admin@menopauseandcancer.org. We will pick up your email and we will respond to you. We're a small team. It might take a little while, but I want you to know that whatever you're experiencing, I'm sure is very unique and very challenging for you, but that there will be many other people out there in similar situations. And I hope that gives you a little bit of comfort. Wherever you are at the moment in your journey, you might be just recently diagnosed and finding our podcast. You might be many years on from your initial diagnosis and still trying to figure out how to do menopause. I hope our conversations can hold your hand a little bit. Yes, with the information. Yes, with the signposting to more support and accessing the right care, but also a little bit of that healing journey is away from the medical system, isn't it? That is you. It's your rite of passage. It's you learning and unpicking and uncovering and trying to figure out what you want to do next, and what are your next steps going to be. And I hope we can handhold you through that a little bit. So I love you and leave you and chat to you on next week's episode on the show.